and they're worried, they're frightened that they might miss something serious. Delays for patients in being seen undoubtedly doesn't just have a psychological toll on them, it can have a physical toll on them in that their condition can worsen and in some cases may even be untreatable by the time they're seen. It's a real concern this winter because you can see the number of infectious diseases going up and up and up. And I can see us getting up to, red alert and what we call black alert sometimes when, we're actually overwhelmed.
Let me just stop you for 1 second there, Steve, I think your name was. We've been in black alert almost continuously, sometimes dropping into red, some very occasionally dropping into orange, and then green is the next one. Never in green. But we've been in black alert for a very long time. That's not a new thing. Like every winter we're in black alert. Plus or minus a few months.
With patients, we need more doctors,
He used to sort his posture
we need more
out
nurses,
as well.
we need more allied health professionals. There needs to be more give in the system.
Man's going to have some occupational back pain.
Good news, exactly.
Yeah, I've been in this room now for about 3 months. It'd be nice to get out, yeah.
We have a lot of medically fit patients, just like sitting, not able to go anywhere because they're so old and unwell in terms of not able to look after themselves at home, but not medically unwell, but they can't go home because they're unsafe at home. So we have to keep them in hospital. Their families won't look after them most of the time because it's a big burden of responsibility, and most of them can't afford nursing homes, and there aren't any nursing home spaces, so we just kind of babysit these sort of not needing to be in hospital elderly people, and then they become sick and then sometimes they die. So yeah, well, I mean, they probably were going to die anyway, but that may have been expedited.
I went for a scan and collapsed, so I was taken into intensive care unit where they diagnosed motor neuron disease.
How are you feeling today?
Well, as well as I can, frankly. I mean, it's a bit of a blow. I thought I was reasonably healthy, but now I'm more of an invalid, really. We haven't got a date for me going home, but there's a lady in today observing. She's from the care company. She's about the fourth person to come in. It's imminent, but it's not quite there yet.
He's just sitting in hospital, looking at the same four walls, not having any quality of life, just because there's nowhere else he can go, and he can't go home because he's probably bedbound and looks like he has a tracheostomy.
About the social care, the crisis in getting care.
No, all this is new to me. Yeah. We're finding out for the first time.
I'm absolutely bloody amazed that he did not realise that there was a social care problem. And I guess you wouldn't, if you're not involved in it, but don't you know any old people or unwell people that can't get care? I thought that was quite a commonly known thing. Also, this guy spent 3.5 months in ICU. Surely not.
My breathing wasn't very good, and then it turned out that I had COVID. I had the 3 vaccinations.
This lady is classic COVID ICU patient. 50-ish, female, overweight. I bet she's got high blood pressure. She might even have diabetes. I'm just getting those vibes.
But I did have the flu jab as well, That saved my life, really. When they said to me I had to come here and go on a ventilator, I was horrified. But, they said that
Maybe she looks a bit older than 50.
was the way to save me. To collapse my lungs down and let the ventilator do the work.
And do you have any sense of how long you're going to be here?
No, not at the moment. But I don't think it's a 5-minute recovery.
Let's start the fourth
Have got that correct. That's, at least you realise that though, because there are people that think, why haven't I gone home yet? Or, oh, they were 95. Why have they died?
So, Richard, medicine.
Fuck, well, we're on the third meeting of the day.
I'm afraid our numbers are very poor. The
Minimum third meeting of the day.
challenge these days has been people getting out to match our demand.
Well, at least their trust gives them the courtesy of giving them a name badge, because mine will not even extend that gratitude because, I don't know, maybe it costs too much, or I don't know, they just don't give a shit. They're like, no, we're not going to give you a name badge unless you, really fucking need it. Not as though I need to identify myself or anything,
I joked about it, that we need to...
Richard Frempong, medicine. What does that even mean?
get the
I love how it's just slowly escalated through the day. 58, 105, 158. That's a fucking lot. I don't know how big their ED is, but that is a lot. We had 90 the other day, and I mean, in our emergency department, the chairs run out. People have to stand up because they can't see their GP, so they come into the emergency department. Or that some people just come in for really stupid things, and you're like, can we not just tell them to go? They don't need to be here. Anyway.
We haven't managed to clear enough beds to manage the emergency patients coming in today. Some days it works, and some days it doesn't work at all, and today is one of those days.
Neurosurgery full. Stroke definitely one.
I mean, it's a horrible juggling act, to do this day in, day out for people. It is really, really tough. I mean, we're going to have a tough old morning tomorrow, aren't we? Based upon what we've got tonight, so we will do it all again in the morning.
Have a hearty breakfast. Discharge unit is still open until 10. Otherwise, we'll see you all in the morning. Thank you very much.
Thanks, everybody.
Fucking sense of joy. Thanks, everyone. See you in the morning. We're going to do the depressing day all over again. And I do think this, I've said a lot. I do think, yes, it's shit, but moaning about it makes it shitter. Can we just stop moaning and just accept the situation? The system and the situation is what it is, right? The NHS, yes, probably could be better, but I can't see a situation where it is significantly better than what it is. I don't know. I think it needs so much more money. Is that money there? So, if we can't change the system, what can we change? I am concerned for the strikes. But anyway, that's enough from me. It's 2 a.m, so it's fucking bedtime, isn't it? Good night.